Hello and welcome to another interesting edition of the program Health Watch. It's a program that gives you information and educates men, women and children on health issues around the world. Today on the program, our topic is on dental care with special focus on the challenges facing dentistry in Nigeria. And we brought to you a specialist in this field that has spent so many years, over 20 years in this field. Plus, we have a feature on COVID-19 vaccine. Trust me, a lot of people out there really want to know what's going on. Has the vaccine coming to Nigeria, and who are the people on the priority list that will take it first? All this we'll be finding out on this week's edition of Health Watch. My name is Ifeanyi. We'll go on a short break. When we return, you will meet my guest. Health Watch continues after this moment. Stay with us.
As Nigeria joins in the global fight against COVID-19, we must all take responsibility for the health of our loved ones. COVID-19 knows no borders, age, gender, tribe, or state of origin, and most importantly, it has no cure for now. The only way to defeat this unseen enemy is to prevent its spread by obeying the NCDC guidelines on COVID-19. Wear face masks in public places and maintain physical distance and wash hands regularly with soap for at least 20 seconds. Do not sneeze or cough into the open air. Instead, use tissue paper or sneeze or cough into your elbow. Generally avoid crowded places. If you develop any symptom, don't wait till it becomes severe. Get tested immediately. Check into an isolation center if you're positive, and remain there until you test negative. COVID-19 is real. Let's fight it together.
This message is endorsed by the Broadcasters Guild of Nigeria, BGN.
You're welcome back. The program is still Health Watch, reaching you on the station for Excellence NTA Lagos Channel 10. Today, my guest today on the program is a former Vice Chairman, Nigeria Dental Association, Lagos State. My guest today is also a founding Vice President of the Association of Private Dental Practitioners in Nigeria, in the person of Dr. Ifeanyi Azuara. You're welcome to the program.
Thank you. It's a pleasure having you.
Okay, so talking about dental care, when we say dental care, what are the first things that will come to our mind?
Well, dentistry is a very limited but specialized part of the body that covers the region of the mouth, extending from your lip to your tongue, to the hard tissues in the mouth and the soft tissues. Looking at it, it looks quite a very minimal area, but by the time you extend and get into dentistry, you discover that there is a lot, much more than this part that I have just mentioned. But to you, my guest at home, anything that has to do with your teeth, the tissues around it, and everything that has to do with the gateway to the body or the mouth is the area in focus. That's the dental field we are looking at. Okay,
Doctor, I mentioned earlier at the intro of the program that we'll have special focus on the current issues in dentistry, particularly in Nigeria right now. Good enough and very interesting to know that you have been a former Vice Chairman of Nigerian Dental Association, Lagos State. For me, that's a plus to this profession. What would you say are the issues currently affecting dentistry in Nigeria?
Well, dentistry has not really, it's quite a very recent area as opposed to other parts of medicine generally, which a lot of guests are used to. But looking at the major challenge facing dentistry, number one is that of ignorance, awareness about dentistry as a field in Nigeria.
Why is that so? Are you saying that is a shift of interest in the medical school? What's going on there? Is it that people are no longer interested in going for this part of medicine?
Well, like I said, there are very few, from onset, we had very few dental schools with limited admissions. The very old generation, universities, University of Lagos, University of Nigeria, Benin, Ife, and a few others started dentistry, while medicine had been running for a pretty long time before dentistry came on board. So you can see that with a limited number of admissions into the various dental schools, that means that the turnout of manpower is equally very limited, where you have fewer than 30 dental graduates coming out from the school as opposed to over 200 medical students coming out from a particular medical school, and the fact that many more schools offer medicine as opposed to dentistry. So that limits the bulk of dental practitioners available for the profession.
Okay, I want to ask you an important question that I think affects people at the grassroots. You go to primary healthcare center, to general hospitals, you don't get to find a dentist there. Why is that so? How come most of the dentists are operating on a private level? What's going on in the public sector?
Well, we have been looking forward to a more robust relationship with government, with policymakers, regarding the practice of dentistry in Nigeria, because it's an area we currently lack people at the managerial level who can influence things towards dental care. We have come up with the idea that there is a need for us to have primary oral health care centers across various states, such that we can bring dental care nearer people. The worst advocate we had was a situation where we recommended that every senatorial zone in Nigeria should have a primary oral health care center, even if we cannot replicate that across all the local government, considering the fact that we do not have enough practitioners to manage the area. But at least each senatorial zone can have a comprehensive primary oral health care center manned by a dentist to bring the dental profession nearer people. So that's part of the advocacy we've been looking at towards reaching out to people and towards ensuring that dentistry cuts across board in almost every state.
Wow. But you know, one of the things we do on this program is also that we educate people in the different about the different fields of medicine. Now, under dentistry, I hear you have dental technician and you have a dentist. So, what is the difference between these two, a dentist and a dental technician?
Well, the dental community is large, quite large at itself, because if you come into dental care, we have various forms of specialities in dentistry on its own. And then we equally have other paradental caregivers who assist the dentist in performing their profession. But in the dental clinic itself, or the dentistry itself, has many forms of specialists in preventive care, in dental surgery, in prosthetic care, and quite a lot, much more than people will imagine. Then we equally have allied professions in the dental industry, such like the dental hygienist, the dental nurse, the dental technician, just like in the medical field where you have other allied groups. But these are all groups that make up the full body of dental care. So you have the dentist heading the section, and then various other professional groups too, who give in their own care for us to have a comprehensive dental care.
Very good. Okay, well, we're talking about the common oral health issues that you find that is very common amongst people, amongst children. children, amongst, we've got a short break from it, so we're talking about that to our viewers at home. Let's go on a short break. Health Watch continues in a moment. Stay with us. My name is Nkem Okibe, and you're welcome to this week's edition of Health Watch.
Those drugs are prescription only, and they are only to be dispensed by a pharmacist because we know how they work and we can save you from using it inappropriately.
But at least if you have a cervical risk, you have a huge chance of never having cervical cancer.
Lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it has been taken.
Glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible.
Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist.
Find out on this week's episode of Health Watch.
Hello, welcome back to Health Watch. Just joining us. Our topic today is on dental care, and our guest is in the house, Dr. Ifeanyi Azuara, who is the former Vice Chairman, Nigeria Dental Association, Lagos State, and also a founding Vice President of the Association of Private Dental Practitioners in Nigeria. Before we went on the break, Doctor, we talked about the common oral health issues we find amongst children, amongst even adults. And the first thing that is on my mind is, I find it difficult to believe when I see children as young as 2, they have cavities already on their teeth. What could be responsible for that?
Well, like I said, I told you about one of the commonest challenges we have in the dental care is the problem of ignorance. And so that leads us to a situation where most patients that approach the dental care come because of pain. And this pain is a preventable, it's something that could have been prevented if enough knowledge or enough information has been passed around. So that brings us to this question: what is the commonest cause of pain? Because the most important reason why patients come to dental care, most often in communities, is that of dental pain. The cause of dental pain is what we call, or the patient known as tooth decay, or caries, as we call it. So if you look at my hands here, you see a model or a caricature of what the mouth is like. This is called a model. We use this for illustration. If you look critically at this tooth, any tooth or set of teeth that has a very dark spot that will not go when you brush show that you have tooth decay or caries. In other words, get back home, look critically with a mirror. Any surface of your tooth, particularly the ones at the back or the molars, that has a dark spot on it, a very dark spot that would not go when you brush, shows the inception or the beginning of tooth decay. This dark spot, when not very well managed, will eventually give you pain. And so that establishes the need for us to see patients at a very early onset. School visits, community visits, and what have you will actually save us the agony, or save the patient the agony or the miseries or loss of time and manpower that is attributed to tooth pain. So a dental pain will result from a very common or very simple tooth decay which is not taken care of, and eventually will bring the patient looking for us with dental pain. But when the patient fails to avail himself of the opportunity of getting to a dental care, he will end up with tooth pain, and that eventually is what brings most patients to clinic. The common symptoms the patient will include pain that will not allow him to eat, that will not allow him to sleep, that wakes him up almost all the time, that will even disturb him from going to school or his everyday activity. And so, tooth pain is very highly prevented.
So, aside from tooth pain, what are the other common oral health issues? Because I have seen someone that for years she complains that she has this pain, that the doctor says she has milk teeth. And I'm wondering, she's a mother of 3 children. How can she have milk teeth? What does it mean?
Well, yes. You see, dentistry, like I said, has very different specialties. There are so many other problems that is common in dental care, like in children, for instance, sucking, delayed loss of tooth or teeth in kids, and then delayed loss of teeth can actually lead to a situation where the patient will have deranged formation or set of teeth, which is what we call malocclusion. And malocclusion will equally showcase certain factors like retained baby tooth in an adult. So when you see an adult complaining of a situation like that, she would have probably retained her baby tooth longer than necessary, meaning that the secondary dentition or the adult tooth that would have replaced the baby dentition will be displaced.
So in that kind of situation, what's the solution? Because you can't continue to have the pain forever.
Well, we always recommend the patient visit his dentist twice in a year, 2 times every year. If this sequence is followed from beginning, a lot of primary care problems associated with dental care will be eliminated from beginning. But because of our environment, most patients will not be able to avail themselves of the opportunity of seeing dentists. Think about our rural areas. How many dentists do we have across the world? Or what's the dental spread in Nigeria? So it's more or less patients who are in urban areas that have more regular or a little bit more frequent dental care compared to their colleagues who are scattered in rural areas or areas that are hard to reach. So that still brings us to the question of the fact that we will need to have fair distribution of dentists across the board, such that certain dental problems manifest from the beginning can be identified by the dentist, who at this stage can be very close to the people if we have dental cares in primary centers.
Wow. Thank you so much, Doctor. Now, moving on from here, I would like you to give us what are the tips for maintaining a good oral hygiene?
Essentially, the key factor in maintaining good oral hygiene is effective oral care. And effective oral care begins with brushing. Knowing how to brush, ensuring that the frequency of brushing twice a day, first thing in the morning and last thing before you go to bed. That will help eliminate the accumulation of leftover food particles, which resides in the mouth usually after every meal. Once you have very minimal residues in the mouth, then the bacteria that causes tooth decay will not find the necessary substrate that is leftover food, which and the end product of which will lead to tooth decay in the mouth. So, to ensure that you have good oral care, please brush 2 times a day. Ensure you change your brush regularly. As of Wednesday, do not use a brush for more than 3 to 6 months. But ideally, I would recommend you change your brush every 4 months. And then for kids, ensure you assist them in brushing, because removing debris in the mouth is one of the key to eliminating the leftover food substrate which retain in the mouth and can lead to tooth decay when not removed. So brushing is a very key factor. And then of course you have to ensure you visit the dentist 2 times in a year.
Thank you so much, Doctor. We'll be speaking with Dr. Ifeanyi Azuara, former Vice Chairman of the Nigerian Dental Association, Lagos State, and a founding Vice President of the Association of Private Dental Practitioners in Nigeria. Thank you so much for coming on Health Watch. I can see you're very busy because it looks like you're coming from the theater, but you still came out to attend to our viewers at home. Thank you so much for the program.
It's a pleasure.
Moving on, our next feature is on the COVID-19 vaccine. And trust me when I say, everyone is curious to know, has this vaccine arrived in Nigeria? I'm sure you also want to find out in this next feature of record. COVID-19 is still ravaging the world. In fact, a lot of countries are on the second phase of the pandemic, with Nigeria inclusive, following the emergence of the vaccine, which is a major breakthrough and a big relief globally. A good number of people are getting vaccinated in the US, UK, and some countries in Europe. Nigeria is amongst the 12 countries in Africa that have indicated readiness of the 92 qualified countries for the facility.
From what I know, the COVID-19 vaccine is yet to arrive in Nigeria. We were initially told that it will come by January ending. So as it is now, what we are hearing is that I think there are some budgetary issues that has to do with it. And they are hearing that it may not come until like April.
As Nigeria expects to take delivery of its first coronavirus vaccine, the question still remains which group of people will be given priority.
Now, in most nations of the world, priorities are given to people that are at high risk. Okay, the medical people working in the medical field, the elderly, and all that first. I don't know who are going to be people to take it first in Nigeria, but I think that we have to give priority to the high risk people. That's the way to go.
With the daily rise in the cases of COVID-19 as reported by Nigeria's Center for Disease Control, it is pertinent that the vaccine should be taken. Dr. Tunji Adeneko, Chairman of Nigeria Medical Association, Lagos Branch, enlightens us on the COVID-19 vaccine.
For COVID-19 vaccine, all we need to know is that is a way for you to give you some form of developing your own immunity to a particular organism so that you don't present with the disease. Now, you may still be infected and you don't come down with the disease. But what we don't know up to now, from what the researchers are saying, whether COVID-19 actually prevents you from getting infected. That true is that the side effects, for every, even when you take, some people take paracetamol, they have some funny feeling in their tummy, flagyl, you take drugs like anti-malaria, you have some funny feelings and all. So for vaccine too, there are some known side effects which are transient, like some people have some mild headaches, maybe have some mild tiredness or fatigue. But these are just normal and expected side effects compared to adverse effects where something totally different happens. And for now, the safety profile of the vaccine is good. There's no so much untoward effects on anyone. So people should not be afraid of any side effects of the vaccine because it's just like taking some of the normal medication that we know, if not even milder of the vaccine.
While we look forward to receiving the coronavirus vaccine, let's all continue to take responsibility by obeying all COVID-19 protocols and government guidelines. Stay safe. It's been a wonderful time on the show today, and this is where we end the program this week. But remember that the doctor said your mouth is the gateway to your body, so good oral hygiene is very important. And of course, when the COVID-19 vaccine comes into Nigeria and is available for you to take it, Why not? Go ahead and take it. It's a big relief for the whole world to know that there's a vaccine to protect us from COVID-19. Remember that COVID-19 is not a hoax. If you must go out, use a nose mask and wash your hands regularly with soap and water. In the absence of soap and water, use an alcohol-based hand sanitizer. Avoid crowded places, very important. For inquiries, for comments, send a mail to okibenkem@gmail.com or ntalagos10@gmail.com or send a text only to 0706086547. Remember that health-conscious people live longer. My name is Ifeanyi Azuara.